Back. It's so good to see everybody. I have with me a very special guest, Dr. Bridget Williams with Green Harvest Health. She practices cannabis medicine in Columbus and Cleveland, Ohio. I first met Dr. Williams about 6 months ago, and I was attracted to her story immediately because at the end of the day in cannabis, we are about the patient journey. And one of the things I love about the way Dr. Williams practices cannabis medicine is she actually practices medicine, doesn't just dispense it. And that is a rap that we have in the cannabis community. And Dr. Williams is really dives deep. She listens to patients. She really helps patients. I joke that in so many of the present forms, a patient will walk into a dispensary after they get a license for the first time to get a recommendation, and they're clueless. A virgin patient has no idea where to turn. That shouldn't be the case, and I'm thrilled to talk to Dr. Williams about the patient journey and why we should dive in deeper as a patient and demand more information before we can start therapy. So, Dr. Williams, thank you so much for joining us today. It's so great to see you again.
Absolutely, it's great to be here. Thank you.
Tell us about your story and journey into cannabis, because you didn't start in cannabis. You started at a very prestigious Cleveland clinic, and you had a lot of options to practice medicine, yet you chose this path very deliberately, and you chose to practice it in a very deliberate way. So tell us about your cannabis journey.
Absolutely. So I think I got frustrated in medicine probably way too early in my career. I felt that I knew more, I could do more, but we got into this pharmaceutical medicine kind of trap, right? Diagnosis, pill. You don't like the pill? I got another pill. And seeing patients every 15 minutes on the same kind of factory algorithm type format. And I was just really frustrated at the time. And I had patients that were more frustrated than I was. And so I actually started helping patients get off of meds, putting them in my lunch hour and the end of the day, and really focusing in on who they were so that I could give them a more personalized approach. One of those patients was a woman that was had just completed her breast cancer treatment and was a new diabetic, and she was very frustrated. And in the process of trying to figure out what would be best for her, she asked me about cannabis. And I thought she was nuts, basically. This is a time where a lot of people were asking me about homeopathic approaches to health and wellness, but this one was not one I had heard. So I looked it up and I figured I'd tell her there's nothing there, and was shocked what the medicinal possibilities were. And that really set me on a journey working with her personally to change her health, her stress, her sleep was better, her blood sugars were getting better, her weight was improving. And from then on, I knew this was something that I wanted to be a part of.
Wow. So how did you start your education? When did you, quote unquote, make that switch and become a practitioner yourself?
Absolutely. So I started out thinking, oh, I'll get certified. When it became legal in Ohio, I'll get certified and maybe do it here and there, weekends, because I was very interested in what cannabinoid medicine was about based on that previous experience. And then when I got a opportunity to work at an office, they said, we don't care what you know, we're cards for cash. We don't do the treatment plans and, everything that I was really excited about. So I realized I needed to go about this in a different manner. And I felt I spent nearly 20 years, crossing my T's and dotting my I's, and that it was time for me to really practice the medicine that patients have been requesting all this time. So I got certified as a cannabis educator and decided to open my own offices and really create that model that I felt was missing in traditional medicine, let alone in cannabinoid medicine.
Well, that's one of the things that is striking to me, and I hear this quite often from practitioners like yourself, who choose to practice cannabis medicine differently and listen to patients, that they, quote unquote, doctor again. And that's striking to me, because this is it cannabis as a treatment protocol, or is it something about that treatment protocol that facilitates you listening to the patient? I'm not sure, which came first, the chicken or the egg, but regardless, what's happening is you're seeing quite often physicians saying that they're getting a chance to doctor again. And it's something about the cannabis plant and the nuances of the cannabis plant that strike that conversation that may not happen with traditional pharmaceuticals. Yeah, help us gain some insight to that. What do you think of that?
Yeah, so I really think that where we are in cannabinoid medicine right now, we're still at the infancy of this. And so any patient that chooses to be in the space, any physician that chooses to be in the space is open to the journey that's required. So instead of this very strict algorithm of the diagnosis, the pill, how you take it, come back and check again, I know how much to prescribe for you based on, tons of studies and what have you. And there's very little conversation there, right? It's all laid out. Number one, when you're talking about cannabinoid medicine, we're early into this. Number two, there's such an individualized response that you get when you're talking about cannabinoids and the method chosen to use it and the terpenes that you seek to give a full effect. And with that, you really have to dig into who that person is, and cannabis allows that.
So you have to listen.
You have to listen.
A neat way to practice medicine. A neat way to practice medicine.
Yeah. Yeah.
And to me, that's fascinating. And I think that is part of the healing process for patients is when they do actually have a doctor that collaborates with them. It's a new form in modern medicine in America, anyway, where patients collaborate with physicians. Talk to us about a patient journey. A brand new virgin patient comes to you and say, I want a recommendation in Ohio. Help us understand the journey. You take a typical patient through to help them understand, do you smoke it? Do you vape it? Do you eat it? The terpene profiles, what a patient is looking for. Help us understand at a high level kind of what an intake might look like for a new patient.
Absolutely. And it really is a combination of everything that I've learned and utilized in traditional medicine and applying it to cannabinoid medicine. So it's not really abandoning where I was. There's something very fruitful about what we understand about the human body and medicine in general, that without that background, you just are not going to dig into those places, right? So the first thing I would say that for a brand new patient, they're probably really nervous. And that's probably the starting point to really key into. They're coming in with emotions and sometimes very desperate, sometimes, inquisitive, distrustful even, because this is something brand new to them, number one. Okay. And then, we do the typical intake to find out about their medications, about their diagnoses in general, about even family history and things that your family members have experienced as well. After really learning about the condition that they're coming in for, I really dig into the review of systems. And so review of systems is really me asking key questions about every system in your body. And the reason is because the endocannabinoid system touches every system in your body. So though we might be talking about your back pain, me understanding your sleep, or that you have headaches, or that you have trouble swallowing, or that you have mild neuropathy, and it's just something that wasn't bothering you, but I find out about that in the case, allows me to really give a more holistic approach to what we're doing with cannabis in general, right? Knowing how you sleep, to me, is first and foremost, because if you can sleep better, everything gets a little bit better, right? And it allows me to learn a little bit more about what your lifestyle is like as well. Yeah. So that's a big part of it. So once I have an understanding of what your condition is, what your daily life might be, and your review of systems in general, then we're really digging into what is your familiarity or your thoughts about cannabis? Because how we utilize it is not just about where do I want cannabis to go, but there has to be a comfort level to what you're willing to try. If you're not a tincture person, if the idea of putting an oil underneath your tongue seems odd to you, then we shouldn't do that. If inhaling is something that you've never wanted to do, we shouldn't do that. And so we kind of look at what your needs are and your experience with cannabis, or just pharmaceuticals in general. Mm-hmm. And then I start cultivating what I think might be the best approach. understanding the other aspects of your life and your condition, and the chemistry and the background of the condition that you're coming in for, I start looking at not just CBD and THC, because we tend to be very focused on those right now, right? But I also consider other cannabinoids that I think might be beneficial, as well as I say, the magic in the sauce is really the terpenes.
Right.
And I have found that I could have the same, let's say, strain with the same cannabinoid profile, and one makes a huge difference for a patient and the other one does not. And that's because of the terpenes involved. So I will start narrowing down what I want what that profile should look like.
What are the clues you get for certain terpenes for certain profiles? I'm curious. I mean, and just like any practitioner is going to have, is it, for someone who needs sleep, what are the terp profiles? I'm curious.
Right, absolutely. So clearly, if I'm looking for someone who has, like you said, sleep, I'm probably going to look a little bit more to the linalool or even myrcene, which is honestly the most abundant of the terpenes, but I'm going to focus in on that. If someone complains a lot about pain, beta-carotene is probably my top one, but you'll see if you look at a lot of these terpenes, a lot of them do help with being anti-inflammatory and helping with pain to some degree, but beta-carotene is definitely the top of my list. So I'm moving into that direction. If they're struggling with anxiety and depression, I then look for something that's high in limonene. But also, if they complain about heartburn, believe it or not, I look for ones that are high in limonene as well, because it can really help with that, sometimes that acid reflux. And so if we don't take those into consideration, and I just say, get some THC and see how you do, it might help you, but you might not be getting the full effect and difference that you were hoping for because we didn't take those terpenes into account.
Wow. Is it a big stretch to help patients learn this? I'm curious. I mean, it's hard for me to understand because I've been in this space now, a number of years. It's hard to understand many times in the pharmaceutical world that I come from, but in cannabis education, is it hard for patients to understand some of these concepts you're lining out for us here today?
So, of course, every patient's a little bit different, and how deeply I go into that conversation depends on what they're ready to take in, right? So some patients really think, well, I'm here because it's cannabis and it's THC. And so we have to we spend a lot of time in that area educating. Re-educating, right? And so some are ready to think about other cannabinoids. And then the terpenes is probably the last thing that I dig into as far as educating about it. Because I think it is sometimes the more, not that it's difficult to comprehend, but to understand that there's so many different layers, I think that's the last layer I dig into. So depending on what they're ready to take on, sometimes I'm just recommending certain products and give them some information, but they're not quite sure necessarily why I'm choosing those. But ideally, our approach to this is education, empowerment, and empathy. So we're looking at people that really want that support. We're looking at people that we want them to be educated. We want them to have wellness back into their own hands. Reclaiming your wellness. So we don't want to just give something to you and saying this should work without you understanding it. We want to educate you, but we educate you on the level that you're ready for. And then empowerment is that the more you understand, the more you're able to figure out some of this for yourself. Yeah. Traditional medicine is really that the medical community holds all the keys, right? We don't tell you too much. We don't give you too much information, just enough for you to come back again. I believe in cannabinoid medicine, my role is so that the more that I can educate you and help you through these nuances, the more that you're able to make decisions for yourself as well. And then you're coming back and reconnecting with me to really look at how your pharmaceuticals might be interacting
Right.
with your cannabis choices, or how things have changed, and you might have some difficulty kind of navigating that. But empowering and educating the patient, I think, is where cannabis is. It's safe enough.
Yeah.
For you to be able to manage this once you have a really good hold of it.
It's fascinating because I like to say in traditional medicine, you go to the doctor writes a prescription. And if you don't fill that prescription, and 50% of prescriptions are never filled, by the way, you're considered non-compliant. If you don't take that prescription exactly as prescribed by the physician, you're considered non-compliant. So the concepts that you're laying out in cannabis are antithetical to traditional medicine, which is why it's so hard for traditional practitioners to get their arms around what you're doing.
Yeah, I guess so. I hate to say it, but there's a little bit of a control thing there, right? Do you provide the fish, or do you teach them how to fish?
Well,
right?
Listen, in pharma, we like to say, and in cannabis, we like to exist at the 3 E's as well, Dr. Williams, to engage, to educate, and empower. So it all comes to empower. It all comes to the more the patient knows, the more the patient knowledge base. And I love what you said, that in pharma, they want you to know some, but not too much. Because if you have too much, you're going to go back to the doctor and ask the doctor questions. The doctors don't like questions.
Right.
In traditional medicine, in the traditional model. In the cannabis model, you embrace the questions. You lean into the questions. You say, oh, that's information, that's data for me to help treat the patient. So it really is, and traditional doctors, over and over and over, I hear that get into this and learn like you do, and say it helps them doctor again, because they're actually listening to their patients.
Yes. I think a big part of it for me is that I'm also a certified life coach.
Right.
So for me, I'm okay not knowing, because we're doing this journey together. Right. That I'm there to empower you, to help guide you, that we're figuring out some of these things together. That is not traditional medicine. Traditional medicine says, I already know, and I'm going to tell you what I want you to know. And traditionally, very uncomfortable if I don't know, right? And if I don't know, then I'll just ship you off to somebody else and let them deal with you now.
Deal with you, right?
I hate to say that, right? But I mean, I'm not shocking anybody by saying that either, right?
Model. That's the model.
So this is a journey that you can go on, and that's more of a coaching model, right? That and a big part of it for me as well is that I don't like to isolate cannabis as if it's the end all be all. That if you are not supporting your use of this with other healthy habits, do not be surprised that you're not getting the results. And I don't think we do that enough in traditional medicine. So I always refer to my wellness toolkit. That if you're working out 6 days a week and then you're eating McDonald's every night, don't be surprised it didn't work out for you, right? And so I ask about what else is in the toolkit. What else do you need to support you? It might be relationships and family. It could be Reiki and yoga, acupuncture, hypnosis. I can go on and on.
You went to medical school and worked at Cleveland Clinic. Come on. Heresy.
Honestly, and I remember really early in my career suggesting some holistic options for patients, and asking one of my colleagues, and if he didn't like me before, he definitely didn't. He thought I was nuts. And I was like, but this is something my patient's interested in, and I don't see why this is a bad idea. Why not discover this? Right. And I don't think we do enough of that.
Right. It's so refreshing to hear the way you practice medicine. Obviously, you've been doing this a while now to see results, and you see obviously the opportunity and access to patients of much better quality products and a wide variety of products. In Ohio and nationally, where do you see the sophistication in the patient journey going? Do you see more doctors starting to practice like you? I mean, I hope so. Do you see more patients seeking out advice similar to what you provide? I hope so. Do you see that as a trend, or do you see yourself as an anomaly?
Oh gosh, no. I mean, I think COVID is a big factor here, because burnout is real. And it was a problem before COVID, and it is a epidemic of its own now after, well, this far into COVID, because we're never going to have a after conversation truly. Okay. And so I think there are going to be physicians that have said enough is enough.
Mhm.
And can I still practice medicine in a way that I feel safe and happy and heard, and I want to be a human being too.
Helpful.
And I think some of those physicians will find it, if given the opportunity, will find cannabis as an option, maybe even for their own medicine, but to be able to help other ones with it as well.
Right.
I believe
I don't
the
think the traditional medical community, up until very recently, really viewed cannabis as medicine. I think they thought of it as a drug, illegal drug. And it's not until patients started to push doctors very recently and openly ask doctors, and the doctors throw up their hands and they don't know. But I think all of a sudden the social stigma is starting to lift, just literally in the last few years.
Yeah. There's definitely a difference, definitely in the last 4 years. And like I said, I think COVID plays a little bit into that. I think you're going to find more physicians leaving some of their traditional pathways to go to cannabis. But what you're suggesting is that cannabis has the opportunity to be integrated into traditional medicine. And we are seeing at least a little bit more of an open door. Yeah. Right. The difference is that we, as physicians, we have always had cannabis patients.
Right.
Always. We just didn't know, and we didn't ask. And if we did, we judged them. And but we've always had the cannabis patient. And so it is our responsibility to understand them, to know how cannabis might interact with their medications, to not judge them for the choice that they're making. And if they need further care, to refer them to the cannabis physician that does want to get deeper into this area. It's inevitable. I mean, keep in mind that at the beginning of my career, integrative medicine was for the hippie.
That's right.
Doctor, to be honest with you. I mean, an idea that a physician's going to spend a little bit more time, or that they're going to accept acupuncture, or they're going to accept even not therapy as an outlier of, or on the outside of their care, but actually a part of their care. That was the hippie doctor. That was not traditional. But now there's integrative approaches that you see popping up in very traditional, old-fashioned health systems. And I think, and that's probably where you're going to see cannabis seep into first. Right. And then, but we all have a responsibility. I don't care if you agree with it or not.
There's 1.5 million physicians in the United States, and hardly any have any education whatsoever on the ECS, on the endocannabinoid system. Yeah. And what's happening now is patients are pushing doctors, and doctors don't know, and doctors are looking for education. So I do believe that we're at a point right now that we haven't been before in cannabis medicine, where it's going to get into mainstream medicine. It's going to get in there in a different way than traditional pharma, but it'll finally start to see physicians making recommendations for cannabis to patients, whether they write a recommendation or say it's a good idea for you to look into it. Here's a practitioner to help look at it. When you start seeing more referrals from traditional physicians, I know we will have arrived.
Yeah. But I will say that we need to be very careful, because I think what will happen is big pharma is very busy right now. Creating these more synthetic cannabinoids. See, the thing is that we're kind of telling physicians to beware, and it may not be real, and keep that as an outlier. Yeah. Big pharma is over there. They've got it. They've bought into it. They're making the synthetics. They just haven't given the doctor permission yet. Unfortunately,
they haven't gotten approved medicines yet.
They haven't gotten approved.
Yeah.
And so, so physicians can kind of boohoo it if they want, but if they wake up, they'll see that the pharmaceutical companies have already approved it. They're busy. They just haven't approved it on a large scale yet to be dispensed, right? And so when,
we also have to look at, we're not just North America. We have to look at the rest of the world.
yes,
You go to Europe, and cannabis is actually reimbursed by your health insurance. So it's a very different attitude. We kind of have this very narrow attitude toward cannabis in the United States that is very, very different in the rest of the world. It's not politicized there. It's not not put into a social vacuum in other parts of the world like it is in the United States, or racialized like it is here. So we need to take our cues from those countries. Because,
absolutely. And it's unfortunate that we cannot have that bigger scope. I have a patient right now in Australia that's, sending me messages because this is something they want to try for their loved one with cancer. And they're trying to figure, it shouldn't be this difficult, Right.
Yeah, it shouldn't be hard, especially for something we know is relatively safe. And that's the thing that drives me crazy is we know it's safe, yet we have all these restrictions around it. So I could talk all day with you, Dr. Williams. This is so much fun. Just diving into the science and the medicine is something that we're both passionate about, obviously. And it's nice to see other like-minded folks in the industry that are pushing for the 3 E's, different 3 E's, but they all end in empowerment.
Yeah, it's all about the education. It's all about the empowerment. And hopefully patients are hearing that and know that there are people that want to support them.
It is a very empowering medicine. That's one of the things I've observed is because when patients do get control, they feel they feel in control for the first time in their lives. They feel, and that's part of that formula. Is feeling in control, is having a sense of self. It's wonderful to see wonderful outcomes, and that's the thing that gets me excited and jazzed. And that's as a physician, that must be what keeps you going, as well as to see the amazing outcomes on a regular basis. But let's do this again soon. It's wonderful talking to you. Thank you very much for your time today, and have a great week.